Yes, everything okay.
Awesome. Very good. Good. Well, it's awesome to see such a big group. Um, and it's a pleasure to be here with you all. So, thank you all for joining. Today, I want to speak about why health professionals, especially in our region, must engage in research, not only as or an academic luxury, but as a core part of what we do to improve care, to learn from our patients and to adapt to evolving evidence. So research is not something separate from our clinical work. It's something that grows out of it. So I'm really grateful that you would take the time from your busy lives and clinical work of providing excellent patient care, helping others to learn and grow from your experiences. So I hope that we can learn together throughout this workshop. Um, so a little bit about me. I live and work at Tillamook Hospital in Bomet, Kenya, for the last 10 years. I'm a volunteer editor with the East Central African Journal of Surgery. I have no financial or personal relationships with commercial entities that could be perceived as influencing the content of this presentation. So this is a brief overview on why. So to kind of think about why we should do research, I hope that these are not abstract goals. When we do research, we ask what is happening here? Why are our patients presenting the way they are? What interventions work? Um, Research rooted in our context leads to better policy. So I hope that we all have the shared goal to improve care for our patients. We also just need to understand the burden of disease in our setting. Also, research allows us to develop problem solving and critical thinking skills that translate to other parts of our lives. And then hopefully we improve care for others by sharing our experiences that could be both regionally and globally. So this quote, I like to share it. It's half of what we teach in residency will be wrong or outdated by the time you finish training. The problem is we don't know which half. So I'm a surgical educator. I have the really cool opportunity to train residents. Um, but the problem is once you finish residency, the learning doesn't stop. And this quote reflects the need for continuous inquiry. So, what we know now is limited. And if we stop questioning or updating our understanding, we risk delivering care that is obsolete or ineffective. So, research is how we stay current and responsible. So, what is evidence-based medicine? That's kind of where research is relevant. So, I do outcomes research, and really my passion is for how research impacts clinical care. There is basic science research, but even that hopefully drives things forward enough to translate to help patients. So, when we're talking about research, within medicine, that's evidence-based medicine, the conscientious and explicit and judicious use of the current best evidence in making decisions about the care of individual patients. So this is the classic definition from David Sackett, one of the pioneers of evidence-based medicine. Um, it's not just about applying guidelines blindly or looking for the latest randomized controlled trial. It's about integrating clinical experience, patient values, and the best available evidence. So I like to think of this as like a three-legged stool. Uh, we consider high quality external evidence like clinical trials, guidelines, and systematic reviews, but evidence alone isn't enough. We also need to apply our clinical expertise, the judgment that we develop over years of training and practice. And then third, we must respect and integrate the patient's values and the unique context, including cultural, spiritual, and social factors. If any one of these three is missing, the stool just falls over. And true evidence-based medicine balances all three. So when we generate local evidence through research, we help make evidence-based medicine possible where we work. Otherwise, we're applying data from elsewhere that may not apply to our patients. So I believe that we've all encountered a model of teaching and practice we might call eminence-based medicine, the idea that what the senior consultant says must be right. That model relies on personal authority and historical precedent, and it often resists scrutiny or change. When we do research, we can offer a different paradigm. Instead of saying, this is what I do, we ask, what does the data show? We let outcomes, not hierarchy, guide our decision making. So since this presentation is about research, is there any evidence that evidence-based medicine actually helps? So that, of course, yes. One example that I've highlighted here is the Better Colectomy Project. So as a surgeon, this is a good one to show how evidence influences outcomes. It was a multi-center study where teams were assessed on whether surgeons were following evidence-based best practices during colorectal surgery. And the findings were clear that greater adherence to these evidence-based steps was strongly associated with improved patient outcomes. So the lesson's simple. When we follow evidence-based processes, patients do better. And that's why research is important. So if we can agree that we should be using evidence to guide clinical decisions, then the next question is, where does that evidence come from? This map was produced by the National Science Foundation, and it shows the global research output by country. And what do you notice? The vast majority of published research comes from the United States, Western Europe, China, and a few other high-income regions. But much of sub-Saharan Africa, including the context many of us work in, is nearly invisible here. This doesn't mean that important clinical work isn't being done in our settings. It just means it isn't being written down, analyzed, and shared in the global evidence base. And I don't want us to look at this map and be discouraged about what's happened in the past. There are certainly systematic injustices that got us to this point, but I hope that we can see this as an incredible opportunity that we each have to contribute to the global conversation. And each of us at our hospitals and our clinics hold valuable insights and unique perspectives that deserve to be shared so that we can change this map. We also face real barriers to accessing evidence. And this is not just about intention. We need tools and training to overcome these barriers. Fortunately, many resources now exist, and as we'll see, we can become producers of knowledge and not just consumers. So because I have the opportunity to share with this audience, and I'm looking forward to sharing more in future sessions, but I wanted us to kind of kick off with a few of my favorite tools because I have the audience and I have the opportunity to say that there are often better ways to do things. And I'm a big advocate for sharing resources, and I'm excited to learn from others about helpful resources. So these are some of the things that I found to be useful. Um, for example, a literature search that once took hours can now be done in seconds. This presentation involves searches on open evidence to explore available solutions to identified problems. And if you're not yet familiar with this tool, I highly recommend it. Open evidence is probably the best part of this presentation. So you should check it out. You can, if you're in Kenya, they usually let you register with your medical registration. You just need to share maybe your ID or upload your license, and they'll let you on. So there's other things that I think are helpful. Elicit.com also helps to synthesize the literature. There's a free version of that. So I'm a big fan of open access uh, journals. So Africa Journals Online, PubMed Central, the directory of open access journals. I hope you'll learn throughout this time, if you're not already familiar with predatory journals, how to avoid those and how to access content from open access journals. There's a browser extension called Unpaywall, which helps to access legal and free articles. And then I've recently found the NCCN framework for cancer care has guidelines by resource availability, which I think is a really cool opportunity to make evidence-based medicine and research relevant to the context with what you're working in. A few of courses that I often recommend are free courses. There are, of course, paid versions, but I'm a huge advocate for things that do not cost, such as EpiInfo, Google Colab, and RStudio for data analysis. Then for writing, we all know that there's generative AI. Hopefully throughout um, this webinar, these sessions, we'll learn how to carefully use them. It can get us into really big trouble if used unethically. So I think disclosing use and using it carefully supervised, it does have the opportunity to level the playing field. One of the challenges that I see as a journal editor is that my reviewers often are concerned about grammar and language, and it becomes a big barrier for those who are writing in English in maybe their fourth, fifth language. And it's quite a challenge within our region. So carefully supervised generative AI can be helpful. I also like Zotero for reference management. And then when trying to figure out a place to publish, it's often a question I get using jane.biosemantics.org, where you can put your abstract in and it can give you a list of journals. That at least helps you to get started about where your research might fit. And I will again say that open access, so that allows other people to read your work, is great. But I would encourage you to find open access that either doesn't cost anything, where it is diamond open access, like you don't pay to publish and the readers don't pay to read. It's a very rare model, but our COSEXA journal is that. But really through all of these things, I hope to stress that anything that you do within the research space should hopefully not cost you money. And if it does, look for other solutions. Maybe expand your team or find other opportunities. So if you find yourself needing to pay for something to do research, really question whether that's necessary. So I think that's a big barrier to that map that I showed earlier, is that there are things that keep us out of the research space. But hopefully some of these tools can help us to overcome those things. And hopefully over the course of this series of lectures, we can engage further with that. So, in my conclusion, I just want to end with that research is not just about publishing papers. It's about becoming the kind of professional who keeps learning, who admits uncertainty, and who improves care by asking better questions. And that mindset is the foundation of excellence in clinical practice. So, why do we do research? Because our patients deserve care informed by the best possible understanding. And that's our understanding. Because we are witnesses to patterns and problems that no one else sees. And because asking questions is how we honor both our patients and our profession. So I really hope that we can all have the humility to learn, to normalize asking questions, to integrate evidence into our daily practice, and to encourage critical thinking. So I really hope this helps to say why, and then we can get into how we do all of these other things. So back over to you. Appreciate the opportunity to share, and really looking forward to learning from all of you. Thanks.
Thank you, Dr. Robert Parker. It's a pleasure sharing the platform with you, and thank you for the precise presentation on why we need to do research and what is needed. I'm going to be also sharing my presentation, which will be lasting for only around 15 minutes. And I'm just going to be introducing our journal. That is Journal of the Kenya Association of Physicians. And then I'll also say a few words on why we need to do research. I hope my presentation is can be seen.
Yes, Dr. Bundi, we can see your presentation.
Thank you very much. So my name is Dr. Bundi Karau. I'm the managing editor of the Journal of the Kenya Association of Physicians. And I'm just going to speak a few minutes on why we need to strengthen local research. But before that, I'm going to give a short history of our journal before I go to why we need to strengthen local research, just building up on what Dr. Robert has spoken about. So our journal was established in 2018, that is March 2018, and it is a peer-reviewed journal which is published within the African Journals Online. Dr. Robert Parker has alluded to that, and it follows the Diamond open access model. That means that we don't charge for others to publish, and also we don't charge for people to read from the journal. If you're trying to look at journals, you realize that premium journals, for example, if I take the Lancet, they will charge on average 3,000 to 4,000 US dollars to publish. And some of them will also charge for readers to read the articles. And that is a big impediment, of course, unless we have libraries or some people even subscribe personally. But unless research is funded, then it becomes a big problem to publish in those journals. So JOKAP publishes twice a year in March and September. Already we have the March issue out. I'm going to be showing that. And it publishes a wide range of articles from original research, letters to the editor, case reports, reviews, opinions, and even book reviews, obituaries. All those are open. And we encourage submissions from researchers, especially in medicine, but from across the board. So as I've said, it's an open access journal. So the articles are free, submission is free, no charges for article processing, as well as accessibility is free, so that we don't place financial barriers to the sharing of local information. This is our editorial team. We are led by Professor John Omondo, who is a consultant rheumatologist and professor of internal medicine, University of Nairobi, and that's the rest of the team. Drawn mostly from the East, Central, and Southern African, the College of Physicians. We also have a technical team assisted by Mr. David Ngede, Dr. Vincent Samuel, Kulud Nuran, and Gloria Natalie Wafula. And we're in the process of starting an internship system whereby we onboard interns, especially upcoming doctors who want to learn about research. And also about the journal processes, peer review, submission of manuscripts, typesetting, and all the processes that go behind the curtains to ensure that an article, once submitted, is peer reviewed and is published. This is our current issue, which was the March issue, which is right now we are preparing our second issue of the year, and we also do publish. For example, this year we are going to be having the ECAJS-JOKAP meeting for the region is going to be held in Kenya. So the abstracts there will be published in this journal. Also, the Kenya Cardiac Society, the Kenya Diabetic Study Group, the Kenya Association of Physicians, whenever there is a conference and the abstracts submitted, we publish them here, and they are a rich source of information for not only physicians, but doctors across the board. So these are the archives. And if you go to the website or you just go to Google JOKAP Journal, then you're able to see most of the archives and see the local research that is being done in the field of internal medicine, and also get quite some good information. So we have onboarded a robust peer review process to make sure that whatever goes out there is peer reviewed. And by peer review, I mean that when an article is sent, It is first assessed by the editor for suitability in the journal and then sent to reviewers. And these reviewers are researchers in their own right. They are going to look at the article and make corrections and tell us whether the article actually meets the cut for the journal, the standards of the journal and global standards for that matter, or it should be rejected upfront, or should be reviewed with major or minor corrections, or should be accepted as is. So whenever we talk of peer-reviewed or peer review, it means that you don't just publish what is sent. Somebody else looks at it and looks at its suitability, the methods used, whether they are robust enough, the language used, whether it's scientific, the conclusions drawn, whether they are relevant, or whether they are, they tally with the method used. Because some methods can't draw certain conclusions for that matter. That is what peer review is about. And each one of our papers in the Journal of the Kenya Association of Physicians is reviewed by at least two reviewers. So if it's in the field of neurology, we'll send to neurologists who are researchers and so forth. If it's cardiology, if it's public health, we'll send to researchers in those fields that we have a rich repertoire of reviewers who do that job. So one of the things that journals look at is impact factor, but for the purposes of this workshop, I don't want us to dwell much on impact factor, but you realize that journals that are not diamond access, that change for publication and also for access, have high impact factors. They have more robust processes. Some of them have been going on for a long time. For instance, the New England Journal of Medicine has been continuously published since the year 1812. And so you can see, getting a paper there, the acceptance rates of the papers is only 5%. So papers, for every 100 papers sent, only 5 of them are accepted. And so if you are starting on research and unfunded research, then you know that we've got to focus on our local journals, the COSESCA journal, the Journal of the Kenya Association of Physicians, to strengthen them first, even before we can think of going beyond the borders. So basically, for example, you can see the impact factor of the New England Journal of Medicine, the British Medical Journal, the Journal of the American Medical Association, Lancet, very high impact factors. While most of the journals in Africa, some of them even don't have an impact factor because it depends on the number of citations that the articles have been cited. So this workshop is being held because of a grant JOKAP received from the Electronic Information for Libraries, EIFL, through the African Journals Online. The African Journals Online is a platform that publishes many journals around Africa. And it's an important platform for anybody who is wishing to do research in Africa to go to, because it incorporates, I would say, approximately 70–80% of the journals from the African continent. So through this, we received this, and it actually is what has funded this workshop, which we are going to be having, and which is going to, teach us from conceptualizing a project all the way to publishing. So basically, if you visit the website, very easy, we use the OJS system, and so I'll not go through that, but you can visit and see, and if you have a paper, we are going to be showing you how you can do this. I will end by just adding a word to what Professor Parker said about why we need to publish. And to do that, I'll give a personal example on publishing and why we need to publish. Of course, these are the reasons. We need to provide local data and local case scenarios to highlight the epidemiology of disease in our populations. Anytime I travel and people ask me what is the mortality rate of multiple sclerosis in your population, I'm lost for words because there's no local research. Not that we don't have multiple sclerosis, we do. Not that we don't have mortality from multiple sclerosis, we do. But what we do is that we have not documented that and published in a coherent manner for us to be able to see whether our mortality rate is the same as, for example, in India or China or Europe. And that, of course, is a failure on our part. We need, to document the epidemiology of disease in our populations. and then also to document our challenges and achievements in the African setting. We rarely do that. In research constrained, resource constrained settings, what challenges and how do we actually improvise so that if in Kenya somebody working in Uganda, or vice versa, if you're in Uganda, somebody working in Kenya can actually draw lessons from your research and apply it to the patient. The other importance of publishing is visibility of authors and institutions. Most institutions want or would want you to publish so that you are visible. Other researchers and other doctors know. These days, it's not uncommon that if you meet Professor Robert Parker, for example, the first thing you do is to Google him. You go to Google Scholar and Google is Professor Robert Parker. And what will come out most likely is the kind of research he has done and that is published. And that is very important because it then forms part of a scientific community that brings people together. And finally, there is career and institutional growth. An institution cannot grow by just seeing patients and treating patients. Doing research is actually what brings growth. It brings creativity, critical thinking, collaborations, just as Professor Parker has spoken about. There are a lot of misconceptions about research. We think that only researchers or only people in the research institutions like Kenya Medical Research Institute, the Wellcome Trust, and such can do research, but that is not true. It is not true that you must have funding to publish. You can actually publish your findings wherever you are. It is not true that only big ideas can be published. Even any idea can be packaged and published because it has consumers. It is not true that only new ideas can be published. The presentations of disease, the circumstances of patients are different from across populations, and so not only new ideas can be published. There is also a misconception that only those working in universities and research institutions can publish. That is not true. Those working in hospitals, in clinics, and many other areas in the field can also publish because we are always continually observing trends. We are continually observing new ways diseases present, new challenges that they bring, new responses to treatment, or even surgical interventions that we can publish and give other people some new information. I'm going to give an example of why we need local research, and this is from my personal experience. And I've drawn from this paper that we published in the African Journal of Neurological Sciences in the year 2022. In the year 2017, when I was a final year registrar in internal medicine, I was rotating in the neurology ward at the Kenyatta National Hospital. And so being the senior resident, I was called to review a patient in the gynecology ward. And the patient had come from the district or the regions, and I had muscle weakness, and at one point had fallen and lost some front teeth. But she found herself in the gynecology ward because after delivery, she had lost the baby. The baby was born at term, was okay, but died within 6 hours of delivery. And so within that postpartum period, the patient came to Kenyatta National Hospital because she was just, after delivery. That's how she found herself in the gynecology ward. And when I was called and I went and reviewed the patient and examined, I made a diagnosis of myasthenia gravis. And when I made a diagnosis of myasthenia gravis, I told my professor then, and we agreed that I present in the grant round, the internal medicine grant round, because we did not see many cases of myasthenia gravis. And one of the questions he asked me is, how common is myasthenia gravis? Which demographic of patients are likely to have myasthenia gravis? And what is the outcome in Kenya? Of course, I went to the good old Google to Google, and all I found were only 2 papers, case series, one written in 1956 by Dr. Harris at Kenyatta National Hospital, a report of 4 cases published in the Proceedings of the Royal Tropical Society, and then a further report of 9 cases by the same Harris in 1969. So 1956 and 1969, scanty cases. He had not described much about the patients, but just described that myasthenia gravis occurs in Kenya. And I saw these patients with myasthenia gravis, they were this age, that's all. And I felt challenged that we've been seeing myasthenia gravis, but we cannot even document those experiences for doctors who wish to learn to read and also to be able to identify those patients easily. That challenged me, and I proposed that we do that research, even if it was not part of my research. And so we did a 10-year retrospective study from the year, I think, 2006 to 2016 at the Kenyatta National Hospital. And in short, the findings we came out with was that the commonest form of myasthenia gravis was ocular, that most of the patients, around 60%, were female, that the mortality rate was around 16.7%, but most importantly, that there was a 1-year diagnostic delay, and the diagnostic delay went up to 4 years. Some patients had symptoms for 4 years before diagnosis. And so we documented that. And since we documented this is one of the easiest research I have done. It has been cited from across Africa because it provides data on the local challenges that people face with myasthenia gravis. So whenever I go and I'm asked about myasthenia gravis, at least I can quote and I know the challenges. And this paper is also a point of information and a point of teaching to people that myasthenia gravis occurs, and it's ocular and mostly female in this demographic, and there's this diagnostic delay. That is the importance of research, that if we document what we see, then we are teaching somebody else, and also we are providing information so that other patients don't pass through the same problems. So with those few remarks, my dear colleagues, that is the importance of this workshop. It is so that when you see an exceptional case of myasthenia gravis in the district, or a case of stroke that looks a little odd, you can publish so that somebody else seeing that case somewhere then will not have, to beat about the bush. When they go to Google Scholar or PubMed, they can retrieve, and therefore they are able to treat the patient a little faster because this is something that is already described. I would also like to challenge us that if you look at most universities, University of Nairobi, Moi University, and many other universities, there are so many theses, dissertations, describing many aspects of disease, some of them with very good methods, but have never been published. If we publish that information and made it available in the public domain through, these journals like the ECAJS-JOKAP journal and this JOKAP and many other journals that we have in the region, then we will have a good repertoire of information that upcoming clinicians, upcoming researchers can use, so that then we don't repeat mistakes that others have made. So that's the importance of this course. It is basically to take us from that low point, that research, you can start from wherever you are with whatever you have. You just need to have something, a justification, and it does not need to be something that has never been described. It can be described, but you come forward with a new perspective. That brings me to the end of this, and thank you. I welcome you to this, and I'm hoping to see robust engagements as we do this course. And after this, most likely, and hopefully we are going to have a better publishing culture, a better reading culture, a better clinical culture, more creative and critical thinking. Thank you. I hand over to Vincent. He's there. He is our moderator to tell us the way forward, just an outline of the course, and then we shall call it a day. Thank you.
Thank you so much, Dr. Bundi and Dr. Peka. I think you've quite done justice to just providing a background on why exactly we have set out to take up on this course, but also the need for conducting research and the need for each and every one being equipped with the necessary skills and capacity to conduct research in the different thematic areas. Perhaps in the next few minutes, I would like to just share a couple of things, most of which has been mentioned. Initially, I'll just provide a brief background on what the East and Central African Journal of Surgery is, as one of the partners in executing this workshop. And thereafter, a brief of what follows in terms of the workshop proceedings. So the East and Central African Journal of Surgery is the official publication for the College of Surgeons of East, Central, and Southern Africa. And initially, it existed as a proceeding for the Association of Surgeons of East Africa, which was first published in 1978. But then it adopted its current name in 1995, about 30 years ago. And from then, it has had its status as a fully peer-reviewed journal, published on a quarterly basis. So you have heard from Dr. Peka. Dr. Peka is our 2025 operational editor-in-chief. The journal is largely coordinated through a given set of teams. So we have a senior editor-in-chief, who is Professor Bebe Bekele, who leads a team that is composed of the editorial team and an editorial board. So under the editorial team is what you are able to see now on the screen. So we have the senior editor-in-chief, and then we also have 6 deputy editor-in-chief, and we usually have operational editor-in-chief, which runs on a rotational basis. And for the year 2025, we are fortunate to have Dr. Peka as the operational editor-in-chief. Apart from the editorial team, we also have an editorial board that provides oversight and ensures that the journal is running as it should, but also ensures that the ethical elements and the policies that are set forth by the journal are actually adhered to. And this editorial board cuts across different countries, covering the COSEXA member countries and extending into a few representation from other continents as well. So we do have a peer review platform on which submissions are made that is provided through Scholastica. So this allows authors to easily make submissions, track their submissions, and in case of any reminders, it is also facilitated through the system. It is through this same platform that we have reviewers and editors interact with the manuscript at different stages of the peer review process. And ideally, the editorial workflow is similar to what Dr. Bundi has shared, where you submit a manuscript, it undergoes initial screening by the managing editor to just confirm that all the elements of the author guidelines are adhered to. Once it passes initial screening, it is then reviewed for fit by an editor. The editors would then send the manuscript to external peer reviewers. The peer reviewers would then provide feedback, and in that same case, provide publication recommendation on whether to accept, reject, or offer a revision, whether major or minor. And once that is relayed to the author, if the author addresses all the comments that have been raised by both the editor and the reviewers, then an editorial board discussion is had where a consensus is made for that specific manuscript, and the decision is finalized by the editor-in-chief, after which the paper goes through the publication process just to ensure that the manuscript aligns with the journal format, but also so that it is assigned a DOI and it is formatted to ensure that its outlook is appealing. So once manuscripts are accepted, we do have them published in the official journal website, and I've appended a QR code to the right of the screen. Should you want to have a look at the journal website and familiarize yourself with the different components from author guidelines, the type of papers that we do accept, but also to just familiarize yourself with the team behind the journal. So the editorial team, as I'd outlined earlier, but even more the bigger editorial board, and maybe even look at a couple of issues that have been published over the past 3 decades that the journal has been in existence. So speaking of the issues published by the journal, so as I mentioned earlier, the ECAJS initially existed as a proceeding for ASEA in 1978 and obtained its official name as a peer-reviewed journal as the ECAJS in 1995. So since 1995, the journal has been published consistently, initially published on a biannual basis, And most recently, we have been publishing on a quarterly basis. This has given rise to a total of 69 issues being published and over 1,000 articles. And to enhance and propagate visibility of articles and to support early career researchers, we run on a fully Diamond open access model with no fees charged to either the authors or the readers. And so all the material that is published at the ECAJS is free and fully accessible. And also authors are allowed to submit their manuscripts without having to encounter barriers such as author processing charges. And currently, as I mentioned, we run on a quarterly publication basis. And appended below is the 2 issues that have already been published. So volume 30, issue 1 was released on the 1st of April, and volume 30, issue 2 was released on the 1st of July. And so if you, and I'm hoping that even as we go through this workshop, we are able to either come up with new concepts, come up with new ideas, or for those who have already come up with maybe a thesis output and you'd want to convert it to a manuscript for publication, in case you are targeting to have it published as part of the ECAJS proceedings, if it falls within the scope of the journal, we have 2 more issues for the year. That is volume 30, issue 3, that would be published on the 1st of October. And we have volume 30, issue 4, which would be published on the last day of 2025. That is the 31st of December. So we are currently indexed on several databases. The most recent indexing is through the ASCII, African Index Medicus, and AfriScholar databases. And we are currently in the process of having the journal indexed in other databases, including the Science Citation Index Expanded, as well as the Emerging Sources Citation Index. The reason I mention this is because indexing is quite important to ensure that the articles that are published in the journal are accessible not just regionally, but also extending beyond Africa to the other continents, so that the content that is published sourced from the region can also be able to find relevance and utility beyond the African region. So to this end, this is just a brief outline on the visibility and article downloads from 2024. We had about 1 million article downloads from all over across the world, spreading across the different continents. And so the readership is quite diversified, extending across all different regions of the world. And so narrowing it down to the main reason we are gathered here today and for the next couple of weeks, I'd like to give a brief outline on how the workshop is structured, what are the expectations, and perhaps what we hope that you will have been able to achieve by the end of our interactive sessions on a twice weekly basis. So you have probably seen this poster circulating around, and possibly you scanned the QR code and got registered. And my hope is that even as you are attending today's informative session, that you have some expectations that you hope to achieve by the end of this workshop. So ideally, as you may have been exposed to before, the workshop will run over a course of about 3 months. That is the end of July, then we have the whole of August, the whole of September, and the first week of October. So this totals to 22 sessions, and they are conducted every Monday and Thursday from 7 to 8:30 p.m. East African time. I understand most of the participants are spreading across different time zones in Africa and beyond. And so we will be having it at 7 to 8:30 p.m. EAT. You might need to convert that in case you fall within other different time zones. In the event at any point, maybe the time might be adjusted slightly, you will receive prior communication for ease of planning. The session is coordinated by a team of experienced speakers from both the ECAJS journal and the JOKAP journal, 5 from each of the teams, amounting to a total of 10 speakers. All the sessions will be conducted virtually via Zoom. And we hope that with each session, each of the 22 sessions, we have assignments and learning objectives that we hope that it can be a bit more self-directed to ensure that whatever is covered during the sessions, you have a practical component to it. Of course, we do aim to provide certificates, CPD accredited certificates for each of the participants. However, to ensure that each of the sessions are meaningful, but also to ensure that the training is robust enough and translates to certification, these are the criteria. So initially, and that will be shared at the end of this meeting, you will receive an email that will guide you towards a pre-workshop evaluation form. This pre-workshop evaluation form is just ideally to assess the baseline data or baseline state for each of the participants, just to know where exactly you are at in line with the topics that will be covered. We also expect that for you to get a certificate, to have attended at least 75% of the live sessions. So attendance will be monitored across all the sessions, just to ensure that we go through each of the sessions systematically and that you're able to utilize the content in each of the sessions to address the assignments and the learning objectives. Of course, we understand that from time to time, you may be able to probably have conflicting agendas, or maybe might not be able to join in on any of the sessions. So we will provide all the recordings a week after the conclusion of a given session on YouTube, and you will also receive the respective links for the same. Now, the third is also important because it ensures that in comparison to what you scored perhaps in the pre-workshop evaluation, that with the content that you're receiving for each of the sessions, if it can be meaningful enough, then you can be able to score at least 75% on the post-workshop assessment. So we hope that for all attendees, if you're able to meet these 3 criteria, then you will be provided a certificate for participation and attendance of the workshop at the end of the period. Perhaps to give a brief overview of the program, I'll share the Excel sheet that just outlines what to expect. And this, of course, will be circulated after this session as well. So this is where we are at today, the introduction to the program. And as you note, each of the sessions have a set of learning objectives, but also most importantly, an assignment that, of course, it's self-directed to try see if each of the sessions would have a measurable outcome. So we hope that at the end of this session, the task here is hopefully that you've been able to understand what the Journal of Kenya Association of Physicians is. You've understood the East and Central African Journal of Surgery and their role in facilitating this workshop. Number 2, and which is what we are covering right now, to understand the course outline, the expectations, the expected outcomes, but also most importantly, the criteria for certification. And then what Dr. Pika and Dr. Bundi have so comprehensively covered, the need for conduct and participation of research by health professionals within the region. So we trust that these objectives have been covered through this session, and we hope that at the end of this today's session, you are able to complete the pre-workshop survey form that will be shared to you as still part of the criteria for certification. Now, after that, you'll have a session on research conceptualization, which is followed by another session on an overview of study designs. And this feeds into the 2 next sessions. So after an overview, you'll have a more in-depth discussion on descriptive study designs, then you'll have another session on experimental study designs. And having understood the study designs, then you will be taken through how to conduct a literature search and how to pull references through citation managers, an example being Zotero, and how to appropriately perform referencing both in text and generating a bibliography from the same. Now, having covered the initial, I'd say, foundational topics, you will then now move on into just getting skills on how to write a research proposal, which is segmented into two. You have the first section on how to conduct, or rather how to populate an introduction section, just having the flow of thoughts, and a literature review section. This, of course, on the literature review will be referencing a lot of the concepts that are covered in the previous section. Once this is done, you'll have a section on how to write a methodology section for a proposal. And within the methodology section, you'll cover elements around research ethics. And still along the same lines, you'll have an introduction to data analysis and data management, and which will thereafter be segmented into two. So you'll have descriptive analysis and you'll have analytical analysis. And what we try to do in this section is that apart from the didactic sessions, for example, the part 1 on descriptive analysis and part 2, what follows would be a practical session where you'll be able to go through how to, for instance, use SPSS to carry out descriptive analysis and use the same to carry out analytical analysis using predefined data sets. And so this is very important because you are not only taken through the theoretical concepts, but using an actual data set from what you would collect in a given project, go through how to practically think through what sort of analysis to do and how to actually do it on SPSS as an example of a data analysis platform. So after these sessions and the practical sessions, you'll have a session to just move on now and understand how do you prepare a results section. And this would cover both preparing a results section for a thesis, for instance, and how to repackage that into a manuscript. And then you'll have another session on how to draft a discussion section, and then now putting it all together, how to prepare manuscripts. So at this stage, I understand that we have different levels of expertise and experience with reference to research. There are those who already have theses and are interested in converting those theses into manuscript that can be disseminated through different publication models. And so you will go through how to exactly convert a thesis to a manuscript, but then also those who would have at this level perhaps developed a proposal and collected data. They will also gain skills on how to package all that into a manuscript. Since both the ECAJS and JOKAP and really the recommended model is a peer-reviewed form of publication, we will equip you with skills on how to, one, take your manuscript through the peer review process as an author, but we will also hint on a few areas in which you can be able to contribute to the peer review process by serving as a reviewer and also serving as an editor. And so really our hope is that by the end of this workshop, you are able to enhance your capacity, not just as an author, but also contribute to the peer review process as a reviewer and also as an editor. Now, most of the workshops that are training on how to conduct research often end at this stage. But we believe that we're in the era whereby if something is not seen visibly, then it is probably not known and its existence is not felt. And so is its impact. And so we trust that it's important to equip each and every one of us on, you have published a given manuscript, what do you do thereafter to, one, enhance the visibility, but also ensure that visibility translates to impact. I'd give an example. So on the ECAJS website, we do have altmetric capacity, whereby each of the articles that are published, you can be able to see how many article views, how many downloads, and how many social media shares, or how many redirects from social media has a particular article received. This is important because you'd find that a given manuscript or a given publication has a lot of key information, but without proper visibility, whether in social media platforms or in research profiles. And this feeds into the next session. You find that without that, then its impact is not felt, and the information that is published doesn't reach the key audience. Then beyond just publishing, we believe that it is important to not just have a lot of articles published and a lot of data out there. We believe in synthesizing information in an ongoing fashion and ensuring that what we publish translates into policy, which translates into strategies and actual impact down to patient care and policy change that leads to an impact at the very user-based level. And so we included a session on implementation science just to equip us with key, an overview really of what implementation science is. How do you translate a given outcome and have a ripple effect down to where it actually matters, and also how to utilize these frameworks to ensure that the papers that you do publish do have impact. Now, at the end, a huge barrier that limits the conduct of research within our region is financial constraints. And so we hope to, close the workshop by discussing about what are the funding options that you do have as a researcher, and how can you put together an award-winning grant application. And we believe that if we are able to have an overview, of course, each of these sessions that we've outlined here, each of the 22 sessions would be conducted as a workshop independently. But the goal of the workshop that we are delivering here is just to give you the key foundational aspects that will then enable you to move to the next step and get your career in research ongoing. And then now, hopefully in the next couple of years, we can be able to now offer packages under each of these sessions. And so this is just really an outline of what to expect up ahead. And this can also help you understand and even conceptualize what is expected of you and what you would expect as the learning outcomes or expected outcomes for this workshop. So in the end, of course, as I mentioned, we will have a post-workshop evaluation. And then based on those who would have fulfilled the criteria, we will then provide CPD accredited certificates for the same. So I know I've spent a lot of time to just go through the program, but I really wanted you to get the gist of what is up ahead, but to also hopefully find value in what the ECAJS and JOKAP is offering. And so we hope that through this workshop, really we can change the narrative of the research output, and really to give context to that, a publication was made assessing the capacity of research output in the surgical space within Sub-Saharan Africa in comparison to other regional blocks. And what was noted is that Sub-Saharan Africa, of course, this is probably much higher since the paper was published about 2-3 years ago. But at the time, we had only 1% of the global research output. And so I believe that if we are able to piece by piece just equip ourselves with each of these skills and experience and build experience over the long course of our research career, that we can be able to change the narrative. And so this is really what I just wanted to give an outline of, and to, in the same breath, appreciate the student-run and student-led organizations that have partnered to make this possible, and to ensure that each and every student, whether undergraduate or postgraduate, within all specialties, are able to access this workshop and training module. And so we really appreciate the International Federation of Medical Student Association. We appreciate the Standing Committee on Research Exchange. We also appreciate the Medical Students Association of Kenya. And we also appreciate, I'd say, a visually packaged training body called, I think you might have seen it across the posters, XYZZ, and so we appreciate each of these organizations and these platforms for ensuring that this material, this opportunity, and this workshop reaches every corner where its impact would be felt. So with those probably many remarks, I'd like to just bring this to a close by wishing each and every one of you a lovely workshop ahead. And my hope, my prayer, my desire is that we can be able to feel the impact, to feel and find the value in taking part in these workshops. I understand 22 sessions might feel like there are many sessions spread across 3 months, but I implore that we might be able to find it in our hearts and find the place for just being committed to each of the sessions. And I believe if we are able to attend diligently all the sessions, and for those that you miss, try access the recordings. And as you've realized, one session is giving precedence for the next session. And so missing a session in between might steer you slightly off course. And so I'm hoping that we can be able to maintain the same momentum and loop in any of our colleagues who might want to also join in for the same. So I would like to probably stop there and perhaps invite any. I'm seeing there are no questions so far on the webinar chat. If there are any inquiries, any areas of clarification, please by all means feel free to share your questions, your clarification. But maybe as we do that, I'd just like to invite Dr. Peka, then Dr. Bundi to give any final closing remarks. And then we can see if there are any questions to address. And if not, we can give it a close. Dr. Peka, you're welcome, followed by Dr. Bundi. Thank you.
Great. Thank you so much for that excellent presentation and for all of the efforts that have gone into creating this very thoughtful workshop. I think it's going to be a great opportunity to learn and grow together. And I just want to maybe highlight the uniqueness of these two journals being Diamond Open Access. We've mentioned it a few times. These are rare around the world, and so just know that these are really treasures. And this looks like a great team and a great lineup. Thank you for the opportunity to play a small part in it. So yeah, I hope you all have a good evening, and thank you very much.
Thank you so much, Dr. Peka. And I agree with you that having a fully Diamond open access model is a very good way to foster research and take off all the financial paywall barriers. And so thank you for highlighting that again. Thank you. Dr. Bundi, you're welcome.
Thank you. I want also to echo what Dr. Peka has said, that these journals provide a very good basis from which people can launch their research careers. And I want to ask that we try, be committed for the 22 sessions, actually 21 sessions now remaining. Just 1 hour, on Monday and Thursday. I believe it's achievable. The registration is still open. I can see somebody had asked that question. It's still open. You can share the link with your colleagues. We would like to keep the registration open up to next week because these sessions are recorded. The ones who will not have joined this week across the weekend, they can look at the videos and join even next week. So we'll keep it a little open for a long time so that we can have this going to as many people as possible. I believe that's all. You've laid a good basis, Vincent. Thank you very much. And I believe with this, we are good to go. Thank you.
Thank you so much once again, Dr. Bundi, and to also appreciate your efforts in putting together the grant application towards the electronic information for libraries, through which we are able to facilitate this workshop. So thank you once more for the efforts in just bringing that together. So colleagues, thank you so much for taking or allowing us to take an hour and a half of your evening. And thank you for indulging us and for believing in what we offer through this workshop. And maybe to also appreciate the teams that are working behind the scenes from the Journal of Kenya Association of Physicians and from the East and Central African Journal of Surgery, and for all who are working together to make this possible. And so without further ado, I think I can close this session and wish you a wonderful experience as you walk with us through this journey. Thank you once more and have a blessed evening and a blessed week ahead.